Hi guys, this video I would define as a basic or level 1 shoulder release protocol for overhead mobility. So it's going to incorporate a couple of simple motions to try to get things rolling forward here. So we're going to start with some rolling techniques that typically benefit someone dealing with extreme thoracic mobility and shoulder mobility issues. With rolling, we're going to try to use a ball, and we're going to do about 60 seconds per segment or per section, and there's going to be 3. So I'd like you to perform these on an every other day format or every day if you feel comfortable with it. So let's just get going with it. So 60 seconds each one, and you can go back for a second set if you'd like to after the workout. So first area we're targeting. We're going to get just inside the crease of the armpit, and we're going to follow this ridge down through the sideline of our shoulder. We're really just trying to focus on this area where the lat connects in and starts to weave into the shoulder joint. So what we're going to do is place that ball right into that area, and we're going to lay down into it. And that should you should start to try to look around in a back to front or chest to back format. Find a tender area. We're going to try to get our arm up as best we can, head nice and relaxed, and you can bring your knees up into a tuck position. From here, I'm applying pressure, and I'm bringing my hand up towards the ceiling. Or as you see, I'm slapping the back of the chair here, just for room concern. All right, other thing you're going to do once you find a little sore spot, so you can work a couple reps into one particular area, and then you can go into another. So I just kind of am working along that ridge as I've shown, hand up, and you're going to start to bring it up towards the ceiling. Once again, head nice and relaxed, knees are nice and relaxed, and just focusing on this one motion. So, once again, 3 to 4 reps per section. And you could do one of these 2 or both on a spot that you find to be a little sore. Really working that area just inside of the armpit where the muscles all start to connect in through. So once again, hand front, upwards, hand above the head, upwards. And you're going to find limitations. So let's say your limitation, you can only go this far. That's where you're going to start. And you're just going to go up from there. All right, next area, we're going to affect the pec. So just inside the front of the armpit, along the line of the clavicle. We're going to bring this ball in, we're going to relax our stomach, we're going to relax our middle back. I'm going to press through, and what I'm going to do is I'm going to go towards the middle of my clavicle, and I'm bringing my elbow upwards as I perform it. So, once again, I'm looking for tender spots. I'm actively rolling the ball towards the middle of my body along my clavicle as I raise my elbow up at the same time. Good. 60 seconds, once again. Last one. We're going to work on the top of the QL, try to get a little bit of that lower thoracic to release and rotate and extend a little bit better. So, line of attack, you're going to follow from the ridge of your ribs, just follow inwards until you hit this big pillar of muscle, and you're going to just press in laterally on the inside of it. So, somewhere right about there. You'll feel the ridge and you'll start to work it through it. So, I'm going to lay down. I'm going to, I got a little more room here. I'm going to lay into it. I'm going to roll a little bit onto my side, and then what I'm going to do is I'm going to bring my ribs in. I'm going to keep my head relaxed, and what I'm going to do, I'm going to try to maintain the position with my arm, and I'm going to rotate my knees back up to an upright position. So my head's down, my chest and my shoulders are staying in the same place, and the only thing I'm really moving is my legs. So you see them coming back towards that middle of my body, and once again I'm rotating. And you just see that simple rotation of my legs that I'm performing. All right, 60 seconds on each of those. And we'll go into the next video after this.